Hi, everyone. Thank you so much for joining us for another live talk. Today, we are lucky enough to be speaking with speech pathologist Vicky Fukuhara to discuss the symptoms of language impairment in dementia and how speech therapy can help people cope with their decline in, communication abilities. So she has been practicing for over 25 years, so she has a wealth of information to share, and we are very excited to speak with her. So let me bring her in. Give me just 1 second. There you are. Hi.
Hi, everybody.
How are you?
I'm good.
Thank you.
How are you?
Great. Thank you so much for joining us. We've got, let's see, we've got a couple people on here. Great. So as more people are joining us, perhaps you could just, before we get into questions, give us a little introduction on kind of who you are and what you do.
I am a speech pathologist with, yes, over 25 years of experience. And I have a private practice currently, and I do also subcontract work. But my specialty has always been based with individuals who have suffered any type of neurological injury. That's been my passion for all this time. I never looked back. And it's just fascinating to me, neurological rehabilitation. So I've stuck with it ever since. And here we are.
And how, I mean, you and I were just chatting about this a little bit earlier, but how has that changed during the pandemic? Doing this all virtually for the most part.
That could be another session, but definitely learning experience, I think, for all of us clinicians who are so used to one-on-one and personal therapy sessions in the comfort of either an office or someone's home or someone's, environment. It took a lot of getting used to be honest. It's harder to connect with patients, especially when they're going through something like, their inability to talk.
Right.
How do we coax it out of them over, the internet per se? It took a while for me. It was a adjustment, I'm sure, for everybody out there.
Is that something that, a loved one, caregiver can help, like facilitate, in these sessions? Can they be a helping hand for you to kind of, because you're not able to have that tactile connection?
Mm-hmm. Mm-hmm. Definitely. I rely on the caregivers or the loved ones, the husband or wife, all the time. One-to-one therapy or via, a Zoom call or whatnot. They are I can't imagine doing it without their help, and neither can the patient, depending on what stage of difficulty they are. They need their other person there to help maneuver the computer or, help show me their examples of work or whatnot. So they're invaluable.
Yeah, I'm sure. And, before we get a little bit deeper, I just wanted to remind everybody watching that you can submit any questions to our comment link below, and then probably towards the end, we can get to any questions that you may have. So firstly, I wanted to know, how do you use speech therapy as a tool to help patients? And are there specific strategies that you use? I'm sure each individual session is very personalized, but are there, some specific strategies or tools you gravitate towards in your clients?
That's a great question. It is very individual. I tend to gravitate to whatever their strengths are. I think we all have to with this, with that decline that, this disease happens to progress to. So I start with, what are they good at? I know what they're not good at. Let's say word finding, for example. I know they have a really hard time accessing their vocabulary. So what way did they learn best before? Were they visuals? Were they auditory? They'll sometimes tell me, oh yeah, I never took notes. I just memorized everything, back in the day. Okay, so that tells me maybe they were best verbally, and we try to kind of streamline therapy that way, and also tie in the visual, because again, there are weaknesses as everything progresses. So I just try to start with, what are they good at? And what do they like? Do they like the electronics? Some just don't. They don't have a smartphone. It's not up their wheelhouse. So we start with paper pencil, and we kind of go from there.
So do you use kind of art in any way, or kind of using, if they can't find words for something, do you urge them to gravitate towards a piece of paper and a pen? Could you talk a little bit about that?
Drawing therapy, I think, is very underused. And I don't know why. I think we just forget it's available to us and the patient. And I love drawing therapy. I'm not an artist. First thing I tell patients is don't worry about it. But surprisingly enough, oftentimes that can be very intact, especially at the beginning part of the progression. And some of them surprise themselves at what they can draw. And indirectly may bring out more language. So I love doing art. I love doing graphics with color, for note taking, for example. You can tell I'm a very visual person myself. But I think it helps patients also know that there is that side that we can tap into, the creative side, the colorful side.
Yeah, no, I love that. I love that. I think, using art as another form of therapy is always helpful. So, I mean, maybe you could talk a little bit about that process. Like, say there is someone who doesn't know the word, doesn't know, maybe wants an apple, but doesn't remember what an apple is. Is there any strategy that you use to kind of work through that? And does that involve, taking to pen and paper, or something of the like?
I first start with teaching them and or the caregivers a couple of things. I like to start off with, when you freeze up, the tip of your tongue, I know that word, let's say apple, but doggone it, I can't get it out, and they get frustrated. So first off, I say, don't get frustrated, and I go through a 20 question type of thing, but smaller scale. What room is it in? Oh, it's in the kitchen, it's on the table. Got it. Okay, so that gives the listener also a context.
Right.
Instead of a wide open window of I don't know what the word is. Okay, is it food? Yep. And we just kind of go through that questioning, and usually you can narrow it down fairly quickly if your questioning is on target. So, and that to caregivers who don't know, who deal with this every day, that really helps them. It lessens everybody's frustration. So that's one of the first things I do, is I teach the caregivers and the patient how to break that down a little bit, and maybe in the process they come up with the word themselves.
That's amazing. So it's almost, it sounds a little bit like a game in a way,
It is, yeah.
But you definitely have to have the patience for that.
Yes, you do.
Kind of going off what you were just talking about, what are your recommendations for people who are living with someone, a loved one, or someone they're caring for with dementia, who is experiencing speech impairment? So, obviously what you just said is one strategy. Is there anything else that you can recommend that could maybe alleviate that difficulty?
Gesturing, again, I think we forget we can use our hands. Our hands are great communicators, and we don't oftentimes use them. Other cultures do. We kind of don't. So I encourage my patients to use their hands. They can much faster, gesture the apple than they can get the word out, and therefore they don't have to do the contextual cueing. They can just gesture it, and maybe in the process of doing that motion, they'll say, "Oh, I need an apple."
Right.
Yeah. And sometimes the motor movement of doing apple will bring out the verbal.
Interesting. Okay, well, that's another great tool. And then I guess kind of going back a little bit, because we jumped right in, but which is great, but before someone, with dementia or another neurodegenerative disease decides that they need to go see a speech therapist, are there red flags or anything that you see maybe right in the beginning that would warrant you to recommend someone to go and see a speech pathologist?
I would say some of the red flags would be when a weakness really begins to interfere with your life and possibly even safety. Safety is like a hallmark. You know, if a memory issue is becoming to be a safety issue, the patient family members need to take themselves to the doctor for one, and then they refer on to a speech pathologist. We all have memory. We all forget. I forget where I put my keys, but it doesn't interfere with my daily routine.
Right.
So I think when it gets to the point where it's more frequent, or it's a safety issue, or the word finding becomes so that, again, it interferes with basic communication on a day-to-day basis, that's when I would definitely say, have an assessment by your doctor and they can refer on.
Yeah. And how often do you see each patient on average? Is it biweekly? Or, I mean, I'm sure it varies a little bit, but what is a good basis?
My typical sessions are about an hour. For my more advanced patients who maybe can't endure, that long, it's a half hour. And sometimes it's just once a week. Sometimes it's twice a week, either a half hour or an hour sessions.
Great.
It just kind of depends on their endurance.
Yeah, yeah. And kind of speaking to that, obviously a lot of this takes work on the back end. You can do so much in these sessions, but it's really what you take out of them and how you implement them to daily life. So going back to, those strategies, do you give your patients like a list of exercises, or how does that work, kind of take home care, or is there any kind of general practices or techniques you can recommend for anybody watching this?
I often give homework. I give the traditional worksheets. It's just something for them to work on, and they seem to enjoy it. And the caregivers can either assist, or sometimes if they're independent, they can do it on their own. But it's just extra exercise, extra cognitive stimulation for them. I also recommend apps sometimes, depending on, their level of difficulty. Apps are a great kind of fun way if they have access to iPads, smartphones, etc. And I, usually give a generic kind of recommendation. This is what we can work on for the week. Let's work on if you can, use gestures more with your family, and have the family, of course, support that. So there's usually a homework assignment in there somewhere, whether written or verbal.
Yeah, no, that's great. I mean, that only makes sense, right? Just kind of going off that, we have a question here that says, can you post a sample worksheet that you use in app samples? I'm sure I don't know if that's something you would have on hand or could share, but.
I don't have my worksheets ready to go here. I'd have to get up and book and whatnot.
But is there, and we could possibly post this afterwards, but maybe if there's an online resource, or I don't know, a template or something that you have seen online that you could recommend, and we can talk about that afterwards. But
as far as apps, I mean, there's a lot of them out there, but one of the very popular, let's say for naming, and I don't work for any of these companies or anything, but no affiliation. One of them is Tactus. They have a lot of apps out there for patients with language difficulty. There's Constant Therapy. There's a lot of apps out there. It just, again, be aware that it just depends on the level of where the patient is at. It can be way too hard or way too simple. So, on advice of your speech pathologist, if you have one, go with what they recommend. But there are a lot of apps out there, some good, not so good.
Yeah. And so we talked a little bit about, word recognition, but is there any kind of particular memory work that you do to try and enhance short or long-term people's short or long-term memories?
What I try to focus on, usually the long-term memory, and at least initially, is pretty intact.
Mm-hmm.
It's the day-to-day, short-term. What did I have for breakfast this morning? Or I try to instill tools right away. Again, depending on where I get what stage my patient comes to me at, but right away we start working on, okay, what system can we put into place that'll help you get through your day better? Do we need, and should you need, a calendar, wall board up there that tells you what you're doing today? Or is it something more sophisticated like your iPhone or your smartphone? Or is it something that, Alexa's and edge devices, do we put those into place in the home? So that's what I usually kind of zero in on right away when I'm dealing with a memory weakness with patients. I just try to set up something right away and something that'll be useful on a day-to-day basis.
And do you find, I mean, you spoke to this a little bit earlier, but do you find, with apps like Alexa, do some people who maybe you wouldn't think took too much to technology learn? It's, maybe you're surprised about how quickly they learn. Like, oh, Alexa, can you help me with, what's the weather today?
They think it's kind of fun.
Yeah, I think it's fun.
I think it's fun, for basic things, and it also works on their language in a kind of fun way.
Yeah.
They're just not talking to their loved one. They can talk to Alexa and ask her all sorts of questions. And it can be kind of fun, if someone sets it up for them. But
yeah, well, I think that's a really fun option, I think. And it's simple too, once it's set up, it's they're ready to go and ready to respond. So I think it's a great recommendation. So, and kind of in your line of work, what are some kind of common misconceptions about speech therapy for people with Alzheimer's or dementia? Is there anything that you would think that maybe deters people from initially seeking out a speech pathologist for?
I think one misconception is just the term, speech therapist, speech pathologist. A lot of people don't know what we do. They think of speech therapy or speech pathology as school-based therapists, working on speech production or with language learning children, but they don't really realize what we do from a neurological standpoint, attention, memory, word finding. So that's one thing, is educating everybody what we do in all populations, including dementia and Alzheimer's. I think the other misconception is, once you say dementia and Alzheimer's, it's a daunting term. And I've heard even some doctors, they say, oh, they can't do anything, meaning speech pathologists, oh, they can't do anything for you. And we're like, not true. We can bring to the table some tools for the family and the patient. And so I don't want the term of dementia and Alzheimer's to automatically disclude therapy.
Yeah.
There's different types of therapy for different needs. And
right.
So I hope to convey that.
Yeah, I mean, I think that's a great point. And so to that end, I'm sure you've, in your over 25 years, can you speak to some of the success stories that you've experienced, or, someone's progression that you could see, just to kind of maybe motivate some people watching?
Trying to think of somebody.
It doesn't need to be anyone specific, but maybe it could just be, I don't know, just a simple, like, not remembering Apple, but then through this, through the writing or through, I'm just curious to know, and it's okay if not, but.
No. I'm thinking of a particular patient. He definitely had the word finding issues, pretty significant. And so we targeted certain things in his house. And this is also I target core vocabulary. What do they need to know? If they don't have a dog, they don't need to know the word dog,
Right.
but they need to know in their home, what do they need to do? And he was one of them that I did the drawing therapy on. And initially, before he had his progression, he was able to draw beautifully. And he said, as a young man, he loved to draw. But then, he went to work and forgot about it. And we were both amazed at how he could draw. And he never got to really use it as a communication tool. But for that, few months that he could do it, it was a really good tool for us.
No, that's beautiful. Yeah. And is there anything, you mentioned gesturing, you mentioned drawing. Are there any music? I was thinking that, but I didn't. In my head, I was thinking, how would that connect? So can you enlighten us on that?
Music just brings out a different motions to people, elderly, much less even the dementia and Alzheimer's, but it, brings back memories, it brings back good feelings, and it can also facilitate language. So again, depending on the stage of the dementia music is a great way to bring out conversation. Oh, do you remember when we danced to that song? Or, they can sing along possibly. Again, it's verbal, it's movement, it's memory.
A lot, yeah.
Enhancing, so yeah, music.
Yeah, because I remember, my grandfather had, he had Parkinson's, dementia, but he remembered music from his childhood, and when he couldn't find words, it was almost as if he could find music. So I think that that's also a great strategy. We have a couple questions here. One, can you discuss problems that arise with reading and writing?
Yes, especially as you get into like the moderate kind of severe ranges, patients can lose the ability to visually kind of construct and remember the writing, and much less encode reading. Again, breaking it down in therapy as much as we can to help maintain as much reading and writing. A lot of repetition. Let's say their name. A lot of repetition, their family names, again, sticking to what they really need to know. If they don't really need to, know other vocabulary or know how to spell it, but they need to know their name and their wife's name or husband's name and things like that. So repetition with the writing can help, okay, if they practice.
And do you show, say a husband and wife, would you show the husband a photo of his wife, or in what ways do you go about that?
Yeah, there's photos, or there's the photo album. A lot of families put together photo albums, which is a great memory tool. It's a great vocabulary tool. And so you can show the picture of, let's say, the wife of the patient who's the husband, and have them spell the names, or everybody in the family group photo. I would help them if they forgot the first letter. I'd give them the first letter. I'd even maybe make spaces if it's married, and space, and put the M.
Yeah.
So then they just, fill in that, so there's little tricks, little techniques to help them, keep their spelling and reading as long as they can.
Yeah, it seems integral to that. We have another question up here. I don't know if you could speak to this, but my husband is choking more and more, drinking coffee and water. Is there something I can offer to help him?
It sounds like his muscles in his throat are weakening, and possibly his tongue too. So I would definitely recommend a assessment by a speech pathologist, swallowing therapist. Check with your doctor, but that shouldn't be a problem getting that referred.
So are there, and forgive my ignorance if it is there, but so are there different kinds of speech pathologists specific to, like, are you specifically focusing on, language, writing, and recognition, whereas someone else might be, fully focused in on maybe dysphagia or swallowing disorders.
Some therapists really focus on certain things. Not that they can't do other areas, but there's some therapists who are highly focused on, let's say, dysphagia. That's all they do. But not to say that others can't. And some therapists also only focus on children in the schools, and that's all they do in their clinics. So you wouldn't go to them for a swallowing assessment per se.
All right, let's see. We have one here. I find I have some time. I sometimes remember clearly, and then other times I can't bring a word up. Do you know what could be the cause?
My first thought would be fatigue, or being overstimulated. Those are my first thoughts. When all of us are tired, we don't think as clearly. Our brain just wants to rest. Or if there's a lot going on in the environment, let's say if you're in a group discussion, that's a lot for the brain to process, and maybe at that time you might have more difficulty getting your thoughts across, your words out, because there's just a lot going on. Those are my first two thoughts on that one.
All right, so obviously recommendations would be prioritizing your sleep, and then is it like limiting distractions, maybe when you're eating, or maybe in a conversation, maybe limiting one-on-one. Do you have any other recommendations with regards to that?
Especially when you're eating, we all should be, reducing our distraction anyway. But I would just know when you have your good periods of the day and not, and any more vital discussions take place when you're at your best. Mm-hmm. It might be like first thing in the morning, you're really bright, you're more alert per se. Have those discussions then. And then, definitely know your body. And if you're tired, you can't push yourself, don't get frustrated, just maybe go take a walk, clear, just do something not verbal, and then come back to it. Just take a little break.
And kind of in line with what we were talking about with music earlier, do you find TV or movies can help with that as well? Kind of jogging maybe words or phrases for people?
Sometimes I tend not to use TV because then it locks them in to kind of a non-productive activity.
They can't really properly engage.
Yeah. So I prefer them, go to a Zoom group, even a support group or an activity group or something like that.
Got it. Cool. Let's see. I think we have one more here. Do you prepare people with frontal lobe dementia and their caregivers so they can continue communicating for as long as possible?
Read that one more time.
Do you prepare people with frontal lobe dementia and their caregivers so they can continue communicating for as long as possible? I'm not sure what she means with prepare.
Again, depending on the frontal lobe dementias are different. They tend to have a little bit more behavior exhibited. So one thing, depending on where the patient is managing the behaviors, making sure that's not impairing communication, making sure that, they're paying attention or are their behaviors interfering with communication. So that would be my first look at a frontal lobe dementia patient, is seeing behavior and then how that's impacting communication, or vice versa.
Great.
Don't know if I answered that question.
No, I think you did. I think you answered beautifully. And I guess kind of to close it up, is there any kind of broad strokes that you'd like to express maybe we haven't covered, or kind of easy tools that people can look to, if maybe they're not able to access a speech pathologist easily?
I always recommend my patients, no matter what their diagnosis is, stay active. No matter what you can or can't do physically or cognitively or even verbally, just stay active. Don't sit by and let everything pass you by. Don't. Stay physically active, take walks, do your garden. You know, if you can't stand for periods of time, get a chair out there and sit down and still enjoy what you have always enjoyed. Be cognitively engaged, you know, do little puzzles, do crosswords if you can, do word search puzzles. Those are great. If you're into Sudoku, numbers, that's a good one. You don't need a smartphone for any of that. It's all, you know, books, drawing, coloring even.
Yeah.
Coloring those, those like complicated coloring books. Those are great for attention and creativity. So stay active, keep a schedule, keep a consistent schedule, especially later, so that patients know, what am I doing today? Every day, you know, every Monday morning I do this, you know, every Tuesday morning I go here, or I'm doing this. So making consistency in one's life is so important.
Yeah. And then, you know, in those moments, and this kind of came to me when you were speaking, but in those moments of frustration, or, you know, what do you tell your clients to do in those moments where, like, maybe they just feel defeated, or unmotivated?
Lots of encouragement, lots of love, and just what if it's a conversation that's not going well because they can't get the words out? I take a break. You know what? Let's just come back to that later. You know, don't worry about it if it's not vitally like a safety issue. Don't worry about it. You know, let's go take a walk, or let's go get a cup of coffee, and then come back to it. But I don't recommend keep pushing it. Yeah. It just elevates their frustration level.
No, I can imagine. Well, thank you so much. It's been really, really lovely chatting with you. And
oh, you're welcome.
Your advice, I really appreciate it, and I know our viewers do as well. So great.
Thank you so much for having me.
So, all right, enjoy the rest of your day.
Thank you.
Bye.